Good morning, everybody from Nicaragua. I'm delighted to take part in this seminar, which is very interesting. I'm already very interested to hear what is going on in Cuba, and horrified by the shortage of syringes. Let me give you some basic facts about Nicaragua. It's one of the poorest countries in Latin America, but it's been tackling poverty very strongly over the last 15 years, when poverty has fallen by half. Healthcare is free, and indeed the Sandinista government has been investing very strongly in the health system and has built 19 new hospitals since 2007, and 6 more are under construction. And in fact, at the time of when the pandemic started, the country had more hospital beds per 1,000 people than some more advanced countries like Colombia and Mexico in the same region. The US sanctions are less important for Nicaragua than for the other countries we're hearing about today. But the influence of the US is still extremely important, not least because of the US provoked violence in 2018. I won't go into the details of this because we want to talk about other issues, but much of the country was destroyed. There was a particular focus on public buildings and public services. So health centers, health supplies were ransacked, and doctors were threatened. Doctors have been sanctioned since. And so the Nicaraguan recovery process really for the last 3 years from the violence that occurred in that year. It's had to cope with other things too. So we've had the economic effects of the coup, followed by, of course, the COVID pandemic. But we've also had a drastic fall off in tourism starting in 2018. And of course, that's not recovered because of the pandemic. And then in November last year, Nicaragua and Honduras were hit by 2 very severe hurricanes, Eta and Iota, which had a very destructive effect on the Atlantic coast. So as well as the sanctions, we're having to put up with all of these pressures, which are putting severe limits on Nicaragua's economy. Nicaragua had a very active strategy for dealing with the pandemic when it began, or before it began. A COVID-19 commission was set up in January. That's before many countries began to get to grips with the possible pandemic, and even before the pandemic was declared. A plan was published about facing the crisis in February that year. This involved tighter border controls with health checks and quarantines. And one hospital was equipped solely for dealing with COVID cases in Managua, and 18 others were equipped with ICUs that could deal with COVID. All of the health workers, 36,000 people, including porters and everyone else, were trained in dealing with COVID, and health brigades began to visit house to house, and I've often visited houses 3 or 4 times during the course of the pandemic. And there were other measures, but no lockdown. This is an important difference between Nicaragua and many other countries. There was no formal lockdown of the economy at any stage. The country's plan became the subject of criticism by the opposition, and for this reason, the government produced a white paper on its plan in May 2020 in order to show people what it was doing. But this didn't prevent the opposition, financed by the US, from having a drastic campaign to attack the Sandinista government and accuse it of indifference to the pandemic. As part of this campaign, there were ridiculous claims about the large numbers of COVID deaths that would occur, and a citizens observatory, so-called citizens observatory, was set up, which started to issue statistics, false statistics about the pandemic that were often based on rumors or information gathered from Facebook. And this conflicted with the government statistics. For example, at the moment, this Citizens Observatory says that Nicaragua's had 17,300 COVID cases, whereas the official figure is 7,400. And they've particularly exaggerated the numbers of deaths. But it was these figures that were used and are still being used by the New York Times, the Guardian in the UK, by the BBC, CNN, and so on. The BBC and all the other media started saying that Nicaragua was ignoring the pandemic. And then in April, the Guardian, Washington Post, BBC, and New York Times all had stories about the absence of Daniel Ortega, as if he fled the country or himself was suffering from COVID, which wasn't the case. So we had even a large spread in the Washington Post saying that Daniel Ortega was absent, had vanished, and criticising the government's laissez-faire approach to the pandemic. Again, totally false, but all provoked by media that were being paid by the US government, Nicaraguan media that were being paid by the US government. And even in April, when the government had started its vaccination campaign very successfully and very well organized, the Guardian, for example, asked to look at the success of Nicaragua's tackling of the pandemic, came out with this headline: Nicaraguan ruler Ortega rolls out vaccination campaign amid secrecy and doubt. Note that Daniel Ortega is a ruler of Nicaragua, and Nicaragua is often referred to as a regime, as indeed are the governments of the other countries we're talking about today. There was no secrecy, of course, about the vaccination campaign. Let me show you some of the figures about what actually happened in Nicaragua compared with other countries. This was a graph that I produced earlier showing death levels from COVID in Nicaragua compared with other countries in the region. And you can see that even on the figures produced by the unofficial Citizens Observatory, Nicaragua was doing well. But more importantly, in many ways, the Institute for Health Metrics and Evaluation in Washington has this month produced very good figures, and figures that they've calculated themselves for deaths from COVID per 100,000 inhabitants across Latin America, indeed across the world, but we're looking at Latin America at the moment. And these show how well Venezuela, Cuba, and particularly Nicaragua have done during the pandemic, that they really minimized the numbers of deaths occurring from the pandemic, obviously due to the socialized health system that all three countries have got in place despite the sanctions. And the same Institute for Health Metrics and Evaluation has produced some charts showing, for example, the stress on the health systems in each country. And Nicaragua was shown to be the least stressed health system in the whole of Latin America, as you can see from the chart. The green line shows normal hospital systems, and the red line shows congestion and very heavy use of hospital systems. And Nicaragua only had a short period of a couple of months in 2020 when its hospital systems were severely severely occupied. In contrast, Honduras, which of course is an ally of the US, has had a terrible experience in dealing with COVID. There have been widespread protests against the strict lockdowns that have been imposed. The health service can't cope, and still, even at this stage, is severely stressed. There have been over 240,000 COVID cases. There have been plenty of international aid, but much of it has disappeared in corruption. And one of the most famous instances has been 7 mobile hospitals bought from Turkey, of which only 2 are working, and even those 2 aren't working properly. And the people who arranged the contract, which I think was worth $47 million, several of them have been arrested. And the persecution of doctors who protest and journalists who expose the problems in the system continues. We can contrast the treatment by the US of the two countries. Honduras has received 8 million in US aid, it's received equipment, and it's going to benefit from the vaccines that are going to be sent out from the US to the whole of Latin America soon. Nicaragua has had only a tiny amount of assistance, and that hasn't gone to the government, that's gone to non-government organizations which the US favors. It hasn't received any equipment or vaccines from the US and isn't going to get them either. And of course, it's been subject to economic sanctions. Even so, the level of vaccination in Nicaragua is higher than either Honduras or Guatemala. This chart shows US assistance, and you can see how little Nicaragua has received, $0.75 million compared with, say, $28 million to El Salvador. And there's a similar picture with test kits, field hospitals, ventilators, and so on. I want to summarize the effects of the sanctions. US is blocking international loans. For example, World Bank funding stopped, is now resumed. Instead, Nicaragua is relying on the Inter-American Development Bank, where it's supported by Taiwan and other countries. It's become more dependent on bilateral aid, so it's getting help from Taiwan, from South Korea, from Cuba, Russia, and other places. The help that did come from the US didn't go to the Sandinista government, but was used effectively for anti-Sandinista purposes. The US has sent no vaccines, as I mentioned. There have been personal sanctions against key figures in the Sandinista government. So Sonia Castro, who was health minister, is being personally sanctioned by the US because supposedly she closed the hospitals to opposition protesters in 2018, which was incorrect. And so she had to stop being health minister and is only an advisor to the health ministry now. And sanctions are delaying economic recovery after COVID and after the problems of 2018. I think another factor is that US support for the sanctions and for anti-Sandinista media means that Nicaragua is getting no credit for its performance in dealing with the pandemic, which I've tried to describe in this presentation. Vaccinations have now begun. So far, Nicaragua has received about 400,000 vaccine doses, Covishield and the Russian Sputnik vaccines mainly. So far, all older people and all health workers have been offered vaccines. The picture shows somebody called Vilma Nunez, who's an opposition spokesperson or opposition member. And many of the opposition members, prominent people, were vaccinated as part of the campaign. And finally, I just wanted to show a slide which is a picture from the hospital in Masaya. It was one of the 19 equipped nationally to deal with COVID cases. At the peak in early June, it had 90 patients in the ICU with COVID, but the numbers fell off substantially and had fallen to 6 by the end of July last year. And the photo shows an event which took place in August to thank the staff, not only the doctors and nurses, but the porters and the cleaners for their efforts. It was attended by many of the patients who benefit from the hospital services. So I hope that gives you a bit of a picture of how Nicaragua has been dealing with the pandemic. Thanks, Claudia.